Hey guys, what is up? What is up? Welcome to my YouTube channel. This is Julie here. In this video, this is an update version of performs Peri-Care on a female, okay, or perineal care. Can't get my thoughts together or my words. In this video, I will be demonstrating how to perform this skill for testing, okay? And I will be talking you through it also. Now, this skill is performed on a mannequin. Remember, only 3 skills are performed on the mannequin. This skill, Peri-Care or perineal care, catheter care, and the knee-high stocking, okay? Hey guys, you know what? I am using my Insta-Air 360 camera. Yes. So you will be able to swipe your phone or swipe your computer to get a 360 view. That way you'll see how I'm walking to go gather my supplies, how I'm gathering my supplies, emptying, rinsing and drying the basin and placing everything in the designated dirty area or in the linen hamper, okay? So let me know how you like the 360 videos, okay? Let me know. So before I get started, as always, y'all know I'm going to tell you this, smash that subscribe button, especially if you are new to my channel, and if you are watching my videos and they are helping you, please subscribe, okay? Click the like button on this video and all of my other videos, and don't forget to ring that notification bell so you'll be notified whenever I upload new content. So now, without further ado, let's go ahead and get started. So the first thing I'm going to do is knock. I'm going to walk up to the bedside, and the NAE, for any skills you perform on the mannequin, remember there's only 3 skills, the NAE will speak for the mannequin. Good morning, Mrs. Jones. My name is Julie. I'm your CNA, and today I'll be performing Peri-Care. So you want to address the client by name, introduce yourself by name and title, and explain the procedure or nursing task that you are going to perform, okay? Now you want to go ahead and do your opening procedures, just your safety checks, okay? Bed is in a low safe position, all right? Now, if that bed is not in a low safe position, if the level of the bed is up to here, please lower it down to a low safe position. A low safe position does not mean that the bed is all the way to the floor. A low safe position basically means if you were to sit the person up on the side of their bed, their feet will be able to, sit firmly on the floor, okay, or flat on the floor. So that is a low safe position. Just going to check your bed wheels to make sure they're locked, and really check them, okay, because in, ambulation and transfer, that is a step, okay, checking or making or locking the bed brakes. And I'm going to go ahead and give you your call light. And you see I'm placing it in the mannequin's hand, and the reason why I do that is because I'm not going to manipulate that hand in this skill. So I place it in her hand. I am not going to touch it after that. That's it, right? If you forget to ensure that the call light is within that person's reach before you say skill complete, that step will default to a yes, because the NAE will see that the client, the call light is within the client's reach, and that it will default to a yes, okay? So that's why once I give the person the call light, I leave it alone. And if I have to do something with the hand, like with blood pressure or range of motion, I always put it in the opposite hand that I'll be manipulating, so I won't have to touch it again. All right, Ms. Jones, I've done my safety check. Now I'm just going to provide you with privacy. And because I will be turning you in this skill, I'm going to go ahead and raise the side of bed. So you want to go ahead and raise your side of bed, okay, or raise your side of bed, raise the side rail, okay, if you are performing Peri-Care, or if you have a skill such as positions on side. Go ahead and raise the side rail during your opening procedures. That way, because you are going to be a little nervous, you won't forget, if you forget to do so while you're performing the skill, that step will default to a yes because you've already done it. Okay, easy peasy. You want to try to make everything easy and convenient for you because you are the one that is testing for your certification. All right, so I've already done my opening procedures. I've addressed the resident by name, introduced myself by name and title. I did my brief safety checks, making sure the bed was low, bed wheels are locked, gave the client her call light in her hand. I provided privacy, and once I provide privacy, as with the call light, I'm not touching that privacy screen or curtain. I'm leaving it maintained, okay? Then I prepped for the skill, so I came over here and I raised the side rail, okay? Now, it's your turn, okay, to try out the swipe. You can go ahead and swipe your phone and watch me as I walk to go gather my supplies. Ms. Jones, I'm going to go wash my hands and gather my supplies, and I'll be right back. So when gathering your supplies, you'll want to gather the biggest supply first, which is going to be your bath or wash basin. That way, all other supplies you can just go ahead and put inside the basin. So I'm getting 1 towel, 4 washcloths, I'm getting a linen protector, I need some soap, and I need 1 pair of gloves. Okay? Hi, Mrs. Jones. I'm back with my supplies. Now, as I come back, I'm going to turn this table around so you can see. I'm going to set up my supplies in the order in which I'm going to use them. You can call me anal if you want to, but this will actually help you to remember what you need to do next, right? So I'm going to place my basin because I know that's going to remind me I need to go get some water, right? No simulation during testing. I'm going to place my gloves next, then the linen protector. Then I'm going to place my 4 washcloths, my towel, and my soap, okay? Now I have everything, my supplies lined up in the order in which I'm going to use them, and that will also save you with time. Mrs. Jones, I'm going to go put some water in my basin, and I'll be right back. So when I fill up the basin, for any water skills except for foot care, because for foot care you need to make sure there's enough water in the basin so when you place the person's foot in the basin, the water covers their foot. But for Peri-Care, modified bed bath, catheter care, I put the smallest amount of water, probably like about this much water. It's actually less than the 2 line, okay? All right, Mrs. Jones, I am back. The next thing that I'm going to do is test the water. You can test the water while you're running the water in the basin. If you do, please verbalize it, okay? Verbalize it. And then verbalize it when you come back to the bed. Ms. Jones, I've already tested the water. It feels good to me. I would like for you to test it so I can make sure, or so you can make sure it's good for you also, all right? So you can test with your fingers, you can test with your wrist, you can test with your elbows. If you already put your gloves on, you can also test the water with your gloved hand, okay? So I'm going to test the water, and it feels good to me, Mrs. Jones, so now I would like for you to test it. Because this skill is performed on a mannequin, you do not have to place the mannequin's hand in the water. Again, the NAE will speak for the mannequin. All you have to do is to direct the client to test the water. All right, Mrs. Jones says the water is okay. The next thing I'm going to do is put on my gloves. See, now is it clicking while I lay out my supplies in the order in which I know I'm going to use them so I won't forget, right? See? So I'm putting on my gloves. Now, because I have my linen protector lined up next, I know that is the next thing I have to do. So before I uncover the resident, I'm going to prepare my linen protector, okay? I'm going to prepare my linen protector. And now, since I have my linen protector prepared, I'm going to go ahead and uncover the resident. Mrs. Jones, I'm going to uncover you by lowering your sheets. And to make sure I don't overexpose you, I'm not going to lower your sheets any lower than your knees. I'm going to raise your gown. And again, to make sure I don't overexpose you, I'm not going to raise your gown higher than your hips, okay? I'm going to place this linen protector. This will help protect your sheets from getting wet. I'm just going to slide it up underneath you. And it doesn't matter if you place the linen protector widthwise or lengthwise. I usually just place it widthwise, but however you feel comfortable with doing it is fine. The only thing is you need to make sure that when you place that linen protector, it's not only covering the perineal area, but it is completely under that person's buttocks, okay? All right, Mrs. Jones, could you go ahead and raise your hips for me, please? And I'm just going to pull or push this linen protector through. There we go. You can go ahead and lay back down. All right, so I have the linen protector through, and I'm checking to make sure I have it under the person's buttocks. Mrs. Jones, I'm just going to recover you. Now, while you're placing the linen protector, your sheets are going to be manipulated in the person's gown. So after you place that linen protector, make sure you recover the person. If the sheets went below the person's knees, pull them back up to knee level. If the gown got pushed up further than the hips, make sure you put it back to hip level, okay, so you won't be overexposing. Now, here's a tip. After you place your linen protector, or while you are placing your linen protector, if that NAE walks anywhere near you or near the bed, okay, that is your cue to double check that linen protector to make sure it's not only underneath the perineal area, but it is also completely underneath the buttocks. So if that NAE walks up close to you, if I were you, I would go ahead and double check, and I would also verbalize, okay? All right, just double checking, making sure I have the linen protector completely underneath your buttocks and your peri area. And I do, so I'm going to go ahead and start cleaning you. Easy peasy, right? You don't want to give any cause for that NAE to question anything, all right? So the first washcloth, I'm going to wet it, squeeze it out real good, apply soap. Now I'm going to make sure I get the soap all over the washcloth. Now, here's another tip for you, right? Because you have to use a clean area of the washcloth with each stroke. I'm going to fold this washcloth in fours. Now I have 4 clean areas, okay? Because I'm using the open corners of the washcloth. With the first stroke, Mrs. Jones, I'm just going to clean straight down the middle. I'm going to flip the washcloth over to a clean area, clean one side of the labia majora, flip the washcloth over to a clean area, clean the other side of the labia majora, flip the washcloth over to a clean side, to a clean area on the washcloth. I'm going to open the labia majora and clean straight down to clean the labia minora, okay? Now I'm going to place this washcloth on the side of my basin. Remember, the critical element step is how you wash the resident's perineal area and how you rinse the patient's perineal area, okay? So you have to go from front to back, okay? Wash, front to back, rinse, and front to back when you dry, okay? So now that I've washed, I'm going to take my second washcloth. I'm going to wet it. I am not going to put soap on it because this is the washcloth I'm going to use to rinse. Again, I'm going to find those 4 open corners, and I'm going to rinse in the same manner that I washed. So I'm going straight down the middle, flip the washcloth, clean one side of the labia majora, flip the washcloth, clean the other side of the labia majora, flip the washcloth, and then clean straight down to clean the labia minora. Whoops, I didn't open that time. I'm sorry. You're going to open and then clean straight down the middle to clean the labia majora, okay? If you forget to do that, just don't use the same side, okay? Use a different side, okay? And just let them know you need to make a self-correction, all right? So this is the most forgotten step, the drying of the perineal area. I have my washcloth, or excuse me, my towel folded into a 9x9, and then I usually fold it in half again, and I will dry from front to back, okay? And you pat dry. Okay, and always make sure you tell the resident what you're doing. I'm not, because I'm giving instruction while I talk. But if I wasn't giving instruction, I will be telling the resident what I'm doing, okay? So now that I've dried, I've used this side of the towel, so this side is now dirty. What I'm going to do is place the dirty side down on my table. That way I know that the clean side is facing up when I go to dry the person's buttocks, all right? Okay, Ms. Jones, now I'm going to turn you away from me so I can clean your buttocks area. If you are able to, you can hold on to the side rail, okay? The easiest way to turn the mannequin would be to place their hands as if they're hugging themselves, bend the knee, okay? And then on the count of 3, Mrs. Jones, we're going to turn. 1, 2, 3. See how easy that was, turning the mannequin? Call light is still in the mannequin's hand. If you are able to, you can actually have the mannequin to hold the side rail. That way you can work with both hands. All right, Mrs. Jones, I'm going to go ahead and clean your buttocks area. I'm going to take my 3rd washcloth, wet it, squeeze it out really good, apply soap, make sure I get soap over all areas of the washcloth. As I did with the peri area, I'm going to fold my washcloth into 4s so I can have 4 open corners. Now again, you want to clean from front to back. So you're cleaning from the peri area up towards the back, okay? And I'm sorry, I have the camera turned where you can't see. Or maybe y'all can do the 360 and you'll see, okay? So I'm cleaning from the peri area up the middle. Flip my washcloth. I'm going to clean one side of the buttocks, flip the washcloth, clean another side of the buttocks, flip the washcloth, and then clean straight up the middle again, okay? I'm going to place that washcloth on the side of my basin. My last washcloth, my 4th washcloth, I'm going to wet it, squeeze it out really good, and then I'm going to rinse in the same fashion I cleaned. From the peri area, straight up the middle, flip it over, clean one side of the buttocks, flip it over, clean the other side of the buttocks, flip it over, and then straight up the middle, okay? And then I'm going to dry. Remember, I placed the dirty side of the towel on the table, so the side that's facing up, I know is clean, right? And then again, I'm just going to fold it over, and I'm going to dry from front to back with the patting motion, okay? There we go. And then I'm going to place that back on the table. Now there's another most forgotten step, is the removal of the linen protector. I'm going to go ahead and remove it while I have the resident turn to the side. Ms. Jones, I'm going to go ahead and remove your linen protector by rolling it up underneath you. Okay. All right, Mrs. Jones, you can come on back over to your back. There we go. And I'm going to roll this away from me, and I'm going to immediately dispose of it into the trash can. If you place this linen protector in the soiled linen container, you won't get credit for this step because you're not disposing of it properly. So this is a disposable, the linen protector. It needs to go into the trash can. Unless you use a towel as the linen protector, then you would dispose of it into the linen hamper. All right, Ms. Jones, I'm just going to get you covered up real quick, okay? Here we go. Okay, you still have your call light within reach. Cover you up a little bit more here. Call light is still within reach. Bed is still in a low, safe position. Bed wheels are locked. Privacy is maintained. Mrs. Jones, I'm going to go dispose of my supplies, wash my hands, and I'll be back. Now, a lot of people have asked about the side rail. Remember, we're not doing things in reality, right? If this was like a real situation, of course you would lower the side rail. But because this is testing, you do not have to lower the side rail, okay, before you complete the skill. Because the lowering of the side rail is not scored. So I'm just going to leave it like it is, right? I'm not going to waste any time, right? I've already done my closing procedure, so now all I have to do is go dispose of all of my items, all of my supplies, wash my hands, verbalize washing my hands, state skill complete, and now I can start gathering supplies for my next skill. All right, Mrs. Jones, like I said, I'm going to go dispose of my supplies, and I'll be back. So I'm going to carry everything with me, right? So I won't waste time having to come back to get the basin or having to come back and get the soap. I'm going to do things in a logical order. What's closest to me? The linen hamper is closest to me, so I'm going to drop off the linen in the linen hamper. I'm going to drop off the soap in the designated dirty area. Now I'm going to go to the sink, empty the basin. I'm going to rinse the basin. I'm going to get some paper towels. And I'm going to dry the basin. Okay. And you want to make sure you dry the basin good, because you may have some NAEs that will actually go and look inside the basin, and if there's any water still in the basin, they will not give you credit for that step, and that's a multi-test step because it's telling you to empty, rinse, and dry. So you won't get credit for that step. So make sure your basin is dried really good on the inside. I'm going to place the basin in the designated dirty area. Now I'm going to remove my gloves without contaminating myself. I'm going to verbalize washing my hands. I'm going to wait a few seconds, make sure you go through, the steps, make sure I got everything, because once you say skill complete, you cannot make any self-corrections. But I know I did all the skills correctly. I did not omit any skills. Washing hands, skill complete. All right? Okay, guys, so that was Peri-Care. I'm going to turn this camera around here. That was Peri-Care. I hope you all enjoyed that video. I will do another video, probably, with this skill as needed to be performed in testing without, talking or giving instructions, okay? Just showing you how to perform it during testing. If you would like that, please leave a comment below. You want to be able to complete this skill within 9 minutes, okay? 9 minutes, no more than 11 minutes, all right? This is one of your more complex skills. As a matter of fact, you know what? I will do that. I will do that in just a few minutes, and I'm actually going to time myself, okay? So you can see how long it took me to complete this skill. All right. Okay, guys, if you have any questions, if you are loving these 360 videos, please give me a thumbs up or a heart. I think you do the heart like this. Yeah, or a heart. Okay. Or even just leave a comment. Let me know how you are liking these 360 videos. I think that, they're really beneficial because, like I said, you have your Android phone. You can actually swipe it to get a 360 of all my movements, okay? So that's it, guys. Hey, as in the beginning, I'm going to tell y'all in the end, smash that subscribe button, please, especially if you are new to my channel. Kick the like button on this video and all of my other videos. And don't forget to ring that notification bell so you'll be notified. I was going to say so I can be notified, but so you can be notified whenever I upload new content. Hey guys, don't forget about my Smash That CNA Exam book that is available for purchase on my Etsy storefront. My Etsy storefront is www.etsy.com/shop/CNA Quest. That's QUEST. I will see you all later. Ciao.